Hi everyone. So today I'm here to share a case study. So before going into the details of abrasion, when during the clinical postings of our students at GH, I came across many queries on the patient where my students had like how to differentiate the types of abrasion. So this was a case where we found with a patient named Mr. Ramasamy, age 45 years old, and he was being having a road traffic accident at Kunyamutur with the collide of while he was driving the two-wheeler. He met accident with the four-wheeler, and where he had a crush injury as well as so many sort of skin injuries as well. So before going into the crush injury and the types of amputation, I found that like why can't we start on with the types of abrasions and lesions, and then we can distinguish on laceration and many other things which you can see or you can come across a patient with orthopedic as well as derm condition. So as it is dealing with the skin layer, I am being placed this topic under abrasions. So starting on with the case study, his past medical history was like he was a known case of diabetes for the past 2 years, and he is on the just with oral hypoglycemic agents. But there is no history of any other disorders like endocrinic disorders, or might be GI, liver, or even neuro or nephro conditions. And coming upon to the surgical history, the patient didn't have any sort of recent surgeries as he was quite to be said to be healthy, and there was no any other previous scars of surgeries in the abdomen or any of the uh, extremities, as we were able to see only the physical examination findings such as certain abrasions and the sort of scratch injuries were present on the upper extremity, and there was a crush injury in the lower extremity where he was planned with external fixation as well as he is being planned on surgical skin grafting as well due to the crush injury. So coming, not wasting more time on abrasion, let us go in detail onto the case study where we met our patient with lots of abrasions, and which I'll be discussing in the further slides and so. So in this video, we'll be discussing on what is abrasion and what are the common etiologies for abrasion, what is the mechanism of abrasion, as well as the mechanisms to describe an abrasion and enlist the clinical manifestations of abrasion, as well as the grade of abrasion, and how you can distinguish from an antepartum as well as postpartum abrasions, and what is the role of abrasion in MLC, as this plays a major role in case of any sort of medical legal cases, as well as how we are going to manage the type of abrasion and the common complications which can be focused followed by an abrasion. So starting on with the learning objective, starting with abrasion. So the abrasion is a mechanical injury where there is might be the skin is being eroded due to blunt force or due to might be it's like friction. That is destruction of the skin layer, which is mainly involving the superficial layer of the epidermis. And the other name for this abrasion, you can call it as gravel rash or road rash. Starting on with the definition of abrasion, it is a wound caused by rubbing and scraping of the skin or mucous membrane, according to the medical dictionary. So this can be coined as skinned knee or road rash. On the other definitions from the Lewis, an abrasion is the destruction of the skin, which usually involves the superficial layer of the epidermis only. Starting on with the etiology for abrasion, as I told you in the introduction itself, it is mainly due to the skin sliding force across the hard ground. This is mainly due to self-fall or road traffic accidents or due to any contact sports injuries. And the common sites of injuries here evident is that the elbow, knee, shin, ankles, and upper extremity. Coming to the details of mechanism of abrasion. This is mainly caused by friction and compression. So as I told you, friction is nothing but the force which is being against one uh, skin and the other skin, or you call it as the skin with the other blunt surfaces or rough surfaces. And compression is might be due to lateral rubbing by blow, or might be due to drag by a vehicular accident, or fingernail injury, or thorn injury, or teeth bite. The epidermal layer of the cells are flattened and the nuclei are elongated. The rougher the surface, the more rapid movement of the skin is more deeper, and the injury also is going into more deep. So the mechanism of abrasion, like you can see that from this picture, there is a healthy scab and an infected scab. So soon after the friction, you can see that the raw surface is being exposed. The skin raw surface is exposed, and you can see the exudation of the lymph as well as the blood, which produces a protective layer, which we call it as a scab or the crust. These are simple injury, they bleed slightly, heal rapidly, and scar is not formed in the initial stage of abrasion. So coming to the types of abrasion, you have scratches, grazes, pressure abrasion, and impact abrasion. So going into detail with the scratches or linear abrasion, as you can see in this picture, there is fine marks, might be these are thorns or might be some sort of gravel which is in the ground, which is caused peel the outermost layer of the skin. It has no significant length or width. It is being caused by either sharp pointed or might be pointed objects like fingernails, pins or tongs or any other rough instrument. A scratch is being produced from the tip of a knife or razor and is called as a point scratcher. The next type of abrasion is graze wound or sliding abrasion. This is the most common type, and you can see that the patient is going to have a deep bruising surrounding the area, and here you can see that due to the pressure abrasion, which is due to crush injury into the superficial layer. So this is mainly caused by 90° of the skin is being having this abrasion due to pressure. The force of the impact is less, but the duration is more. Might be the ligature in case of a strangulation or hanging or teeth bite marks. You can see this pressure abrasion. And here you can see the impact is very high and the duration is very less. Might be a person being hit with a car. Patterned abrasion is a type of impacted or pressure abrasion, and it reproduces the pattern of the object that is causing the abrasion. The force is being applied at right angle to the skin surfaces. Some of the examples might be imprint of bicycle chain and ropes. So how do you distinguish, or how do you find out the clinical manifestation based on the grades, whether the abrasion is falling under the first, second or third degree? The first degree of abrasion is mainly due to superficial damage to the epidermis, and the pain is very mild and there is no presence of bleeding. In the second degree of abrasion, you can see that there is a damage to the epidermis and dermis. There is mild to moderate pain and bleeding is very minimal or mild. And on to the third degree of abrasion, friction and tearing of the skin of the tissue layer is deeper than the dermis, where patient is going to have severe pain and the patient is also bleeding heavily in this type of abrasion. And how do you find out whether it is a new abrasion or very old abrasion? Yes, if it is a fresh abraded wound, you can see that there is a bright red color. If it is due to 12 to 48 hours after the injury, you can see the scab, red scab, that is the lymph which is being dried up. And if it is due to 2 to 3 days, the reddish brown scab can be seen. And if the scab is, might be the wound is more than 4 to 7 days, you can see the scab is turning into the color to brownish black. And after 7 days, you can see the scab dries and falls off, leaving deep depigmented area, which shows the changes that there is an abraded wound very recently. So here the age of the abrasion you can see in the antepartum abrasions as well as in the postpartum in case of MLCs. So you will be seeing the site where it is present as well as the color, whether it is bright reddish brown in color. In antemortem, excitation is more, scab is being raised, and microscopic examination shows that there is intravital reactions and congestions are mostly seen. In case of a post-mortem abrasions, usually it is present over the bony prominences, that is yellowish, translucent changes in the color, and the exudation is very less because of the rigor mortis, and it is below the level of the skin, the scab. There is no intravital reactions or might be congestions in the postpartum abrasion. So, how does this abrasion play a major role in medical legal cases? This gives an idea about the site of impact and the injury of force and the direction of force. Patterned abrasions helps us to identify what sort of object is being used for injury or assault. The age of the injury can be determined by seeing the scab color, as well as the character and manner of the injury can be known. Example, in case of sexual assault, abrasions may be found on the breast, genitalia, inside the thighs and around the anus. Coming to the management, so here as this is only involving the superficial layer of the skin, here we are going to see the pain level. So according to the pain score of the visual analog scale, we can administer the analgesics and anti-inflammatory drugs as per physician's order. And if necessary, we can plan on with some topical analgesics such as lidocaine or benzocaine for large abrasions. And if the patient is saying of fever symptoms, we can start on with some antipyretics as per physician's order. Topical antibiotics in case if the wound is not healed, such as neomycin, batracin, can be applied to prevent infection and to keep the wound moist. And if the type of abrasion is very deep, then we have to plan for wound dressing as per the type of abraded type of skin, depending upon the degree, as we saw the first degree, second degree, and third degree. Always clean the abrasion with the soap and water at first aid measures in order to reduce the contamination of the wound. And in case of a deep abrasion, inspect for the dirt, debris, and presence of any foreign object around the wound. Assess for any evidence of fracture, as well as watch for any other deep structures or damages such as tendons or nerve injuries or blood vessels. According to the wound dressings can be planned, or if necessary, sutures can be done if the abrasion is very deep and gone into as a laceration. Prophylactic doses of tetanus toxin, that is TT 0.5 ml intramuscular start dose is to be administered, and if the dose is like previously given within 10 years, it is not necessary to repeat the dose. And if the wound is very big, then we may need to repeat the dose. Collect a detailed history of the patient, whether the patient is having a known case of diabetes, any case of peripheral vascular diseases, medications such as steroids and anticoagulants, because these may delay the wound healing. And that is the reason why we collect the diabetes mellitus history as well as peripheral vascular diseases and medications in case of steroids or anticoagulants. Instruct the patient to avoid exposing the abraded skin to the sun to avoid permanent hyperpigmentation may develop in order to permanent exposure. The major complications of abrasions is that infection, further injury, scarring and hyperpigmentation if it is being exposed to sun. So to summarize the topic, we have discussed about the definition, mechanism, types of abrasion, difference between antemortem and postmortem abrasions, and the role of abrasion in MNC and the possible management, as well as the complications of abrasion. To conclude, thus by a detailed wound assessment, the type of dressing and the factors that may delay the wound healing could be screened at the early stage depending upon the stage of abrasion. Awareness and severity of the wound and proper care can help to prevent scarring, infection and further injury. And that's all for today's class. And these are the possible e-references. And thank you so much for your patient listening. If you have any further queries on abrasions, on how to resolve the MLC cases of patients with abrasion, please suggest your comments into the comment box. Don't forget to subscribe, as well as don't forget to forward the link to your friends. Like, comment and share. Thank you for your patience listening. Give me on your comment box on what can be the next topic which can be discussed between you and me. Stay tuned. Thank you.